Hi, I'm Penelope Flowers and I'm a psychologist. So my role as a psychologist comes in both pre and post-surgery. My role pre-surgery is really around assessment and supporting any behaviour change strategies that could occur prior to surgery. And then post-surgery, it's really about following through on those, adjusting on ideas that we've come up with together and seeing how they're working and seeing if we can make any changes that support them long term into the future. I think from a psychology perspective, what's really important is that any kind of surgery is going to be a stress. And when we have stress in our life, sometimes emotional responses can come up. So that's where the pre-surgery assessment can be quite important to spot any areas where we might identify that additional psychology support might be relevant. So it's really just noticing that surgery is a stress. Is there any way that we can support you during that transition period? After weight loss surgery, it's really around those obstacles to getting into a habit and a routine of adjusting to those behaviour change strategies. The main barriers come when they're not putting into place the strategies that either the dietitian or the surgeon or myself have been working with them. So those obstacles often are around, I guess, emotions that might be coming up, that might be getting in the way of them putting into place behaviour change strategies. So the job that I do as a psychologist is really to look underneath those behaviours, look underneath those barriers to changing behaviour and seeing if there's tools that we can come up with that help them to move through those barriers. It's always beneficial to be part of a multidisciplinary team. There's never just one element that solves a problem. And what's really lovely about this team is that I feel that we all pull in the same direction. We want the very best for the patient, want their very best outcome, and we're all committed to delivering that.